They say cancer strikes without warning, but what if that's the biggest lie we've been told? The truth is, most cancers don't appear overnight. They grow silently inside your body for 10, 20, even 30 years. And here's the shocking part. Your body may already be sending you signals, but no one taught you how to read them. In this video, I'm exposing 10 early warning signs of cancer most people ignore, the real reason cancer develops in the first place, and the simple science-backed steps you can take right now to stop it before it starts. Number 1, chronic fatigue. If you're tired all the time, even after resting, something might be wrong. While fatigue is common with poor nutrition or stress, in some cases cancer may be silently draining your body's resources. That's because your immune system may already be in battle mode fighting abnormal cells without your knowledge. If that fatigue lingers for months and can't be explained, don't ignore it. Number 2, persistent pain. Pain that doesn't change, no matter how you sit, stretch, or sleep, could be a warning sign. Especially back pain or headaches that don't respond to typical relief methods. Sometimes it's not a sore muscle, it's a growth pressing on nerves. What is cancer, really? Now let's pause for a second, because to fight something, you have to understand it. Cancer is not an external intruder. It's your own cell that lost its way. Healthy cells grow, do their job, and stop. Cancer cells, they forget how to stop. That's called unregulated growth. And unlike normal cells that specialize and play a specific role, cancer cells are chaotic. They multiply rapidly, without control, and ignore the body's instructions. Why? Because something altered their DNA. Number 3, lumps or masses. Not all lumps are cancer, but they always need attention. Breast lumps, testicular growths, or any strange mass should be checked. Men get breast cancer too, and rising rates make self-exams just as important. Number 4, blood in the urine. Blood in the urine could point to bladder, kidney, or prostate cancer. But don't panic often, it's a UTI, kidney stone, or inflammation. Still, anything involving internal bleeding is worth investigating quickly. How does cancer start? Every single day, your body makes around 400 billion new cells. Each one needs to copy over 6 billion pieces of DNA and makes up to 120,000 mistakes per day. That's normal. Luckily, your body is brilliant. It repairs those errors. If that fails, it triggers apoptosis-programmed cell death. And if that fails, your immune system steps in to destroy the rogue cell. But here's the danger. When all 3 layers of protection break down, mutations survive and multiply. Number 5, unexplained weight loss. Up to 40% of people newly diagnosed with cancer report recent, unexplained weight loss. This isn't the result of a diet, it's a sudden drop due to internal disease. Later stages may even result in cachexia, a severe form of muscle and fat wasting. This happens when the body can no longer properly absorb nutrients or maintain appetite. Number 6, persistent fever. A low-grade fever that lasts for weeks without any signs of infection can be an early indicator of blood-related cancers like lymphoma or leukemia. In later stages of cancer, fevers may appear in other types too. They're signs that the immune system is responding to something abnormal inside the body. Number 7, changes in your skin. Especially moles can be an early warning sign of cancer, and the ABCDE rule helps you spot danger. A for asymmetry, one half doesn't match the other. B for irregular borders, C for uneven color, D for diameter larger than a pencil eraser, and E for evolution, any noticeable change in size, shape, or color over time. If you notice any of these, it's time to get it checked. Any of these could signal skin cancer and should be checked by a dermatologist. Number 8, bowel changes. Persistent diarrhea, constipation, blood in stool, or black tarry stools could signal colon cancer. Bright red blood usually means the issue is near the rectum. Black stool suggests bleeding higher in the digestive tract. Still, Don't panic. Common issues like food intolerance, gut inflammation, or ulcers can also cause these symptoms. Number 9. Trouble swallowing, dysphagia. If you experience difficulty swallowing, it might indicate cancers of the throat, thyroid, esophagus, or vocal cords. But more commonly, it may be acid reflux, GERD, or an enlarged thyroid due to iodine deficiency. Still, any persistent swallowing issues should be investigated. Number 10. Chronic cough. A cough that lingers for months or years, especially in smokers, could point to lung cancer. Chronic bronchitis caused by smoke can damage the airway lining and cause progressive mutations. While most coughs are due to infections, any cough lasting longer than 8 weeks should be evaluated. Simple steps you can take to reduce your risk starting today. Don't let those sudden, scary cancer stories make you feel helpless. The reality is, most cancers build slowly, and your body has multiple defense systems that can fight it off, if you give it the right environment. To outsmart cancer before it begins, start by cutting off its primary fuel, sugar, since cancer cells absorb up to 20 times more sugar than normal cells. Reduce carbs, support your immune system with whole foods, detoxification, quality sleep, and deep breathing to increase oxygen levels, which cancer cells hate. Manage chronic stress through practices like walking, journaling, or meditation, and incorporate intermittent or extended fasting to activate autophagy, your body's built-in cleanup and repair system. Finally, exercise regularly to boost circulation, oxygen delivery, and even DNA repair, giving your body the upper hand in defense and healing. If you found this video helpful, watch the next one where we explore even deeper healing strategies. Subscribe, hit the bell, and turn on notifications so you never miss another life-saving insight from Eat Fit. Your health isn't a mystery, it's a system, and once you understand how it works, you'll never look at disease the same way again.